Hi there. My name is Dr. Katrina Cox, and I'm the author of The Opportunity in Cancer. I'm a naturopathic doctor and the founder of the Cancer Remission Mission. Today, I want to address a thriving mindset. I talk a lot about transforming a survivor to a thriver. And for me, that's a very important thing. But a lot of times I get the question, what does thriving even mean? And the big piece to this is that there are multiple steps to be able to actually have a thriving lifestyle. The first thing is about overcoming fear. The fear of reoccurrence is a big one because many people who've been through the cancer journey have discovered that they don't feel safe in their body. They're always constantly worried about somebody going to tell them that their cancer's come back. A lot of it will be accompanied with what we call scan anxiety, where they're doing the monitoring to make sure that we get to a cancer-free state. And so I wanted to talk about how to overcome all of that because it's very, very important. The first thing I usually talk to patients about is about understanding how to stay present in the moment. And this is a really difficult task because everything is about the future and what if and what if and what if. And so it brings to mind a story about a woman that I just met. Her name is Samantha. Samantha was diagnosed very early on in stage 1 or 2 in her 40s. She had one child, and she was diagnosed with a form of cancer that had a secondary issue in terms of reoccurrence. She had these genes. She carried these intense genes that almost guaranteed her another reoccurrence. Now, in order to combat those genes and that percentage and that possibility, they performed a complete radical hysterectomy. So at the age of 43 or so, she was thrown into chemical menopause. And this was a big thing. And the fear was already there, but it just got even bigger by the fact that she was also going through menopause. So in a conversation that I had with Samantha, we talked about staying present, not worrying about the future and only focusing on those things that we had control, which is our control over choice, the choices that we have and the choices that we make daily. And she said to me, I understand the concept and I know I want to stay present, but I just don't know how. And I said, so this is where the model of finding your purpose comes in. So exploring your purpose every day is very important. And so there are 3 steps to finding your purpose, which can redefine your future. And finding your purpose, especially post-cancer, is very, very important. It gives us motivation. So igniting our determination, although is the last step, is where we get to finding our purpose. But the very first place before we find our determination is identifying our peace. Identifying where it is that we feel the most peaceful. Because when we're in that peace and flow state, it's much easier to see about the choices that we're making and the things that we have control over. The second piece to this is finding our bravery, insight into what makes us brave. Some people that requires partnership or accountability partners. Other people it's journeying and self-awareness and self-discovery. For me, it's the water. When I'm in water, swimming, floating, meditating, playing with my kids, I become very peaceful and I know that I have bravery. When I leave the water, I find that I am more determined than ever to fulfill my purpose on a daily basis. And so going through those steps, each person will be able to transform that survivorship mind frame and eliminate or deal with the fear of reoccurrence. There are some physical things that can help people also maintain that fact or fiction and understanding and monitoring things physically, like our CRP levels or our ESR levels, which are both inflammatory markers. And I talk a lot about in the 8 pillars of health, can help us understand what's going on with our terrain on the inside and give us another step or proof for us that we are in that thriver state and that we are, doing the best for our choices in order to overcome the fear of reoccurrence. Another factor that we can monitor is called our FAR ratio, so our fibrinogen albumin ratio, and that ratio has different percentages. And once you get into those with the 8 pillars of health, you can also use that to help monitor where you're going and getting you into that thriving state. So addressing fear of reoccurrence is really important in order to create that thriving mindset. So please explore the Finding Purpose model, check in with the Cancer Remission Mission and the Opportunity in Cancer, and let's redefine your success today.